Hello guys, so today we are going to discuss about sulfonamides and trimethoprim. So sulfonamides is one of the classic drugs, okay, for antibacterial agent. Okay, these are antibacterial agent and these are one of the classic from it has been discovered very earlier from the first time. Okay, so these are very primitive medicines, okay, and still they are in use now. So sulfonamides is a class of drug. Okay, sulfonamides is a class of drug which includes different drugs such as your sulfacetamide, sulfacetamide, okay, sulfadiazine, sulfadiazine, sulfapyridine, sulfapyridine, and sulfamethoxazole, sulfamethoxazole. So these are all sulfonamides. Okay, so let's see the mechanism of action of sulfonamides. So generally in bacteria, so in bacterial cell, this para-amino benzoic acid will convert into dihydrofolic acid with the help of dihydropteroid synthase. Okay, with the help of dihydropteroid synthase. Okay, and this dihydrofolic acid will convert into tetrahydrofolic acid with the help of dihydrofolate reductase. So this is the first step and this is the second step. Okay, and this tetrahydrofolic acid is a important, it's very important for the synthesis of RNA and DNA molecule in the bacteria. Okay, so if this RNA and DNA molecule is not there, bacteria will unable to multiply. So this is very important for the multiplication. Okay, multiplication of bacteria. Okay, so now what happens here? Sulfonamides, okay, sulfonamides such as sulfamethoxazole and other sulfonamides will inhibit the first step. Okay, inhibits the first step and it will inhibit the formation of dihydrofolic acid. Okay, how it is inhibiting the first step? By inhibiting this dihydropteroid synthase enzyme. Okay, synthesis enzyme. So in this way this tetrahydrofolic acid will be unable to form and there will be no multiplication of the bacteria. So generally sulfonamides are bacteriostatic in nature. So these are not bactericidal, these are bacteriostatic in nature because they inhibit the multiplication of the bacteria. Let's see some of the antibacterial spectrum and indication of the sulfonamides. Okay, generally it is given for the gram-negative bacteria infection in urinary tract and vaginitis infection. Okay, it is also given for pneumococci and meningococci. It is also given for the chronic ulcer, skin ulcer caused by the Nocardia species. Okay, and it is given for the conjunctival eye infection and some parasitic infections. Okay, the drug sulfasalazine. This is a prodrug and it is also sulfonamides. This is a prodrug which is given in the management of Crohn's disease. So this is the indication and antibacterial spectrum of the sulfa drugs. Okay, now comes to resistance. So already I have mentioned what is resistance. So whenever bacteria develop some kind of change in their body, some kind of change in their cell, so that that particular antibiotic will be ineffective against that particular bacteria. Okay, so here in this case against the sulfa drugs, what bacteria is doing? Suppose this is the bacterial cell, so generally folate will be synthesized inside the cell. Okay, so this some of the bacteria have developed some mechanism, they can take folate from outside. Okay, from the environment they can take the folate. Okay, from our body environment they can take the folate and there won't be any utilization of folate inside the cell. Okay, they are directly taking from the outside, so they don't need to synthesize folate inside. Okay, so this and that's why they become resistant to this sulfa drugs. Okay, they become resistant to this sulfa drugs because they are taking folate from the outside environment. They are no more synthesizing folate inside this cell. Okay, this is the some of the mechanism. This is the mechanism for resistance against these sulfa drugs. Some of the adverse effect of sulfa drug is crystalluria. Okay, crystalluria means formation of crystal in the urinary tract infection, in the urinary tract. Okay, or in the kidney. Okay, so what happens? Generally our urine pH is alkaline. Okay, urine pH is acidic in nature. Okay, urine pH is acidic in nature. So if this sulfur drug has a potential that whenever there is acidic environment, these sulfur drugs will form crystal. Okay, whenever there is acidic drug, these sulfur drugs will form crystal. Okay, so that's why it is very it is not convenient to give in patient with kidney failure. Okay, so it should be avoided in the patient with kidney failure because it forms crystal in the urinary tract. Okay, so in this so whenever we are giving sulfur drug to any patient, you should give lots of fluids like 2 to 3 liters of fluids. Okay, okay, 2 to 3 liters of fluids like water. Okay, plus you should give urinary alkalizer alkalizers. Okay, this urinary alkalizers will make your urine pH alkaline, means above 7. Okay, pH above 7, so there won't be any formation of crystals. Okay, so because crystal will only form in the acidic environment. Okay, now next is hypersensitivity reaction. It is also a adverse effect of sulfur drug. Sulfur drug may cause rashes. Okay, and life-threatening hypersensitivity reaction like Steven Johnson syndrome may also occur. So this is the second adverse effect of your sulfur drugs. Comes to third, Hemopoietic disturbances. Okay, so sulfur drugs should not be given in patient with glucose 6 phosphate dehydrogenase, short form G6PD. Okay, so if a person is deficient of this G6PD, this sulfur drug may cause hemolytic anemia in that type of patient. Okay, so it should be not be given in patient with G6PD deficient. Next drug is next adverse effect is carnic tears. Okay, generally this condition is associated with newborn babies. Okay, and in the fetus. Okay, where the blood brain barrier is not fully developed, okay, so if you given in that type of patient, in that type of person who is newborn or fetus, so in that their blood brain barrier will not be fully developed, and these sulfur drugs will displace the bilirubin from the binding site of the serum albumin, and then it will travel and it will cross the CNS, and it may cause problem in the CNS. Okay, so that condition is known as carnic teres. Next thing we have to know about drug potentiation. Okay, so generally sulfur drug will increase the serum level of warfarin and methotrexate by 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 competing with them in for the serum albumin. So suppose this is the serum albumin, so warfarin wanted to bind here. Okay, but sulfur drug will displace this warfarin. Okay, and then sulfur drug will bind itself here. Okay, so this warfarin which is displaced will be there in the blood, so automatically the serum level of warfarin and methotrexate will increase. Now contraindication, already I have told it will cause carnic teres, so it should not be given in pregnant ladies and children's. Okay, and newborn. Next is sulfonamide should not be given in kidney patients, kidney failure patients. Okay, because it will form crystals, so it should not be given in kidney failure patient. Next drug is your trimethoprim. So what trimethoprim's mechanism of action is, it will inhibit the dihydrofolate reductase. It is in the second step. Okay, and it will inhibit the formation of tetrahydrofolic acid, and therefore RNA and DNA synthesis will be inhibited and the bacteria will be unable to multiply. This is the mechanism of action of trimethoprim. Antibacterial spectrum includes same like sulfamethoxazole, but it is 20 to 50 times more potent than the sulfonamides. Okay, resistance, it has trimethoprim resistance is due to the generation of efflux pump. So some bacteria, suppose this is a bacteria, some bacteria has developed some efflux pump. Okay, some bacteria develop some efflux pump. Suppose we are giving trimethoprim and it is entering the bacteria, so this is the trimethoprim. So what bacteria will do, it will take this trimethoprim out of the cell. Okay, so this is known as efflux pump. Okay, out of the cell. So it will be it will prevent itself from trimethoprim by taking it out of the cell. Okay, this is one of the resistance mechanism developed against the trimethoprim by some of the bacteria. Okay, adverse effect of your trimethoprim is generally hyperkalemia, means increase in the level of potassium, and folate deficiency. Now next comes to the chlorotrimazole. Okay, chlorotrimazole will inhibit the bacteria's tetrahydrofolic acid synthesis in two steps, 1 and 2. And you can think what will happen. There won't be any formation of tetrahydrofolic acid, no RNA and DNA synthesis, and bacteria will be unable to multiply. So it is a broad spectrum antibacterial agent, this chlorotrimazole, and it's effective against UTIs and respiratory tract infection, pneumonia, okay, and ampicillin and chloramphenicol resistance salmonella infection. Okay, it is also effective in infections like nocardia species. And resistance, generally there is no resistance found against this combination. Okay, but in some organism the resistance has been seen, like E. coli and MRSA. Adverse effects, so many adverse effects are there for chlorotrimazole. You can see, so it may cause severe skin problem. Okay, it may cause nausea and vomiting. It may cause glossitis, stomatitis. It may cause hyperkalemia. It may cause megaloblastic anemia. It may cause hemolytic anemia. So many are there. Okay, you can read from here. Okay, so it may cause, it is not given in the immunocompromised patient because it may cause fever and rashes in that type of patient. Okay, it may also increase the uh, prothrombin time. Okay, if patient is receiving sulfamethoxazole and warfarin together, so we should be very careful in that one. It also increases the plasma half-life of phenytoin. Okay, and the level of methotrexate will also be increased in the serum if we take together with the sulfa drugs. So these are the indications, some of the indications for the sulfa drugs, chlorotrimazole, and the trimethoprim. Okay, so you can see here, so MRSA, then respiratory infection, then pneumocystis, pneumonia, then listeriosis, then prostate and urinary tract infection, gastrointestinal infection. And this is the clinical management of the clinical management by the sulfonamides and trimethoprim. So what you should assess is that person should not be hypersensitive. Okay, so you should see the person is whether hypersensitive or allergic reaction is there, or anaphylaxis may occur. Otherwise anaphylaxis may occur. Okay, you should ask the person questions like his history of allergy with the sulfonamides, okay, or thiazides or acetazolamide. You should also see whether the woman is pregnant or not, okay, whether he is conceived or not. And you should avoid sulfonamides in infants less than 2 months, okay, or otherwise it may cause kernicterus. Then you should also consider another type of antibacterial medicine in people with renal and liver disease. Okay, so it should not be given in renal and liver disease. You should consider another antibacterial medicine because it may cause kidney problem, because it is forming crystals. Okay, so you should also make assessment for the manifestation of the infection process, and if used for urinary tract infection, determine the relief pain, whether the pain is relieved or not during urination. And you should see the vital signs. Okay, you should assess the vital signs, and you should assess the other medication taken by the person, like methotrexate and warfarins. So these are the clinical management of the sulfonamide and the trimethoprim. Okay, thank you very much.